Everyone. After high demand for our webinar with Tegnell that we hosted in late August, we got a request about hosting this follow-up webinar with a more critical standpoint when discussing the Swedish Corona strategy. Therefore, we're very pleased to have Anders with us today. And we are also very glad to see the audience being engaged. And there are definitely many opinions whether the strategy is good or bad. We will do our best to address as many questions as possible. And I hope you enjoyed this webinar. As we only have 1 hour, I think we should get this started.
A month ago, we had the webinar with Anders Tegnell and how Sweden is handling COVID-19. And I think a lot of people were pleased to hear about that and get more information about how Sweden is doing. But some people reached out to us and not everybody were happy. We got, there was a concern that we should also give a voice forum to the critical voices of the handling in Sweden. And amongst them were Science Forum COVID-19. And as an organization here in San Francisco, we have no bias in this, but I think it's important, especially in these polarized times, to allow for different opinions to be able to express themselves. And on a personal level, I'm really curious to better understand what is going on and why actions and reactions over the world are so different. My name is Mats Andersson, and I'm responsible for the Swedish American Chamber here in San Francisco, Silicon Valley. And with us today, we have Dr. Anders Vahlne. He is Professor Emeritus in Clinical Virology, Division of the Clinical Microbiology at the Karolinska Institutet, and previously Chief Physician at Karolinska Institutet and Karolinska Hospital in Huddinge. He has researched extensively on HIV and herpes simplex virus, and he is also chairman for the Science for COVID-19. Thank you, Anders, for being with us today.
Thank you for inviting me.
And for the rest, we have the same crew as last time. Lars, over to you, a couple of words.
Yeah, thank you, Matt. Yeah, so and thank you, Anders, as well, for being with us. So my name is Lars Johansen. I have lived in the US for close to 30 years. I'm a practicing attorney since a little bit over 20 years. The reason I'm here today, though, is not in my capacity as an attorney, but for the first time, and having traveled most of my life, Sweden became controversial in the spring. And we hear it from time to time in discussions with friends, but often among business people, where we're asked to explain the Swedish approach. And I think that was the impetus to my participation here. Thank you, Mats.
Thank you, Lars, and let's dive into it. Anders, tell us a little bit. Well, in the spring emerged these 22 scientists that we were reading about, even over here, that had a critical view, and I think that later became Science Forum COVID-19. Tell us a little bit more about that organization and what the aim is, and if you can also then jump into what is the main critiques that you are having of how Sweden has been handling the virus.
Yes, we were some researchers and physicians that had written a few debate articles, critical debate articles, how we were handling the COVID pandemic. And we got together and as you say, wrote that debate article in Dagens Nyheter, the largest Swedish newspaper. And some of the wordings there upset a few people, particularly the ones at the Public Health Agency, and that's why we became known as the 22. Our aim was not really to upset, but we were critical, and we think in a scientific society one has to be able to discuss. So we formed this group. And so we started with 22. Now I think we're up to almost 50 of us, and we have people with different expertise. So it's a science-based society, and we try to spread unbiased scientific information about the COVID-19 pandemic. And our mission is really to save lives and to prevent suffering from the pandemic. So the goal is not to oppose the public health agency all the time. And we think they're doing good things as well, and even more so now.
But isn't everyone trying to minimize the impact? And so I mean, you have the same goal as the others.
Yes, but it's, well, of course they are. But sometimes what you do doesn't minimize the impact, and even though you think you are. And you asked about the critique we had, and really, if I take myself already in February, I was really astonished about the information that was given and the decisions that were taken by the Swedish government and the Public Health Agency. And I thought that either the Public Health Agency didn't read the science, because there were quite a few scientific papers coming out. But there were not that many, so you could actually read all of them. And to me, it was pretty obvious, a number of things, like, for instance, that you had asymptomatic spread, that you had that children got infected and could infect other people, that you had aerosol spread, airborne spread, and so forth. And but then again, we didn't know all that much about the virus. And when you have a pandemic and the risk of a pandemic coming in, then you try to do as much as you can to stop it. For instance, by quarantining, isolating people coming from infested areas, which we didn't do. I mean, I was really surprised to hear the Public Health Agency even saying it was, you could fly and have holidays in the Alps. It wasn't any problem. And we know that Northern Italy was in a chaos at the time. When then people came, you didn't isolate them, you didn't put them in quarantine when they came from the infested areas, and which one could have done.
You say this shut down the country, and I think that's something we could maybe discuss a little bit around. So I understand that the shutdown of a country works in a short term when you think that this is really something we have to handle,
yes,
and get on the top of. But how is it long term? Because I mean, if we take here where we are sitting now, where I'm sitting in California, we are kind of in a semi-lockdown for 6 months. Nothing is changing. So how much should you actually do a lockdown, and how long can you do this? Because it seems like the virus hasn't really changed nature since February, March, or maybe it has, but nothing has changed. So how long can you go on with these quarantines and lockdowns? And how much should a society kind of enforce rules on it? Because that's the critique coming from the other side now, people who are lacking their freedom.
Yeah, well, as you know, I mean, it's we don't run around freely in Sweden either. I mean, we closed gatherings of more than 50 and so forth. Even though we kept restaurants open, everybody above 70 have had a lockdown in practical senses. So it's not that we haven't done measures in Sweden, and then even the voluntary measures that people have been doing more than what's recommended. So we have been hit by the COVID-19 pandemic in that sense. But I mean, when you don't know anything, I mean, this could have been extremely deadly. I mean, the video clips we got from Italy was devastating. People were dying and dying and dying. I mean, and not only elderly people, also younger people were dying. So before we didn't know, and we didn't really know how the virus spread. And those countries that did a quick lockdown, did well. Take Norway, for instance. They at the beginning had the same problems that we had, and as many people were coming into the country from abroad. I heard that others been saying that was not the case, but it was. If you get the statistics from the airports, and so that was not the difference between Sweden and Norway. And we've had per capita 10 times as many deaths in COVID as Norway has had. But they did a lockdown. Take Finland, where they did a lockdown, and even, I mean, they isolated Helsinki for a couple of weeks. And of course, as you're saying, you can't do it forever. And but you have to buy time, and the amount of science that came out was, a tremendous amount of science, and so we learned very quickly. And of course, another way is not to learn, also to the healthcare system to learn how to treat, and we're much better in treating the virus infections today than we were, in the spring.
Yeah, I understand that is a big change in how patients are treated.
Yeah.
What if now it seems like Sweden is coming out as someone is praising the Swedish handling. So what if the cost was high in the beginning, but ultimately now it is the winning strategy?
So we've done poorly. I mean, we've had more deaths than the other Nordic countries together, but I think 4 or 5 times as many as the other Nordic countries together. And so, and one more thing, it's not only deaths. About 10% of those that get infected have long-term illnesses, and the virus causes damage to the lungs and scarring of the lungs. It causes damage to the kidneys and to the heart, and even injuries in the brain. So we don't know the long term of those that have been infected. And these long-term illnesses you see also in those that had a fairly mild COVID. And so I think one should try really to do as much as you can. Now, if you do lockdown, I mean, you can start losing the lockdown, where you see that when you find that it's an aerosol spread and so forth. For instance, we talked about face masks. You don't have to really, in my opinion, use face masks outdoors. It's indoors. You have to wear them, and that's one of the problems in many countries that have mandatory face masks, that you have to wear them, and you find if you're not wearing them outdoors, and then they take the face masks off when they're indoors, when they really need it.
We're on the topic of face masks. I actually wanted to add something, because on our last webinar on the topic, we had a lot of questions regarding face masks. What is your opinion on this? You were talking a little bit more about it before, but why do you think Sweden haven't implemented any guidelines regarding this?
Well, I must say, I don't know. It's I think that they prestige. I'm sorry to say, I think that's one of the reasons, because they said that face masks don't work.
Do you think that people might be less cautious with face masks? That people think?
No, I don't. Actually, people there have been studies looking at this, and common sense tell you, when you see one with a face mask, you step aside, and you're reminded of the pandemic. I visited my doctor the other day at the hospital in Stockholm, and none at the hospital was wearing face masks, and so I don't understand that. I mean, it's
that sounds unreal from our perspective, how that can even be. Lars, over to you. Do you have something here?
Thank you, Mats. Yeah, I have, and I agree with you, Anders, that I think it's difficult to argue success when you have that many people dead and infected, and we have a similar situation here in the US. But So like Mats said, we have been dealing with this since February. I think the lockdown started in March. I have 3 kids that do online learning, one at the college level. And so many people lost their jobs, so on, but the magnitude is huge. It's huge. And I think it's hard to even comprehend. And I think we will know eventually the cost of it all and the stress on society. But if you were to compare the different countries, and you mentioned you had learned things about the masks since February, March. If someone were to ask you today, and having looked at the different ways the countries approach it, would you answer differently today compared to a year ago?
From a year ago, I didn't know anything really about how this virus would spread. Nobody knew. I mean, if you take the 2 previous serious pandemics by coronaviruses was the SARS in 2003 and 4, and then 10 years later the MERS, the Middle East respiratory syndrome virus, MERS, and they behave very differently. They were easy to isolate the patients, and here, because they, like I said, the people really spread the virus after they were sick. But here you spread the virus before you're sick. And my belief is that what's driving this epidemic, this pandemic, is asymptomatic people without any symptoms whatsoever. And you should remember one thing, and that is that what we have learned is that automatically, when we test if with the what we call the PCR method, where we look for the virus genome, the virus RNA in samples from the patients, we also get a hunch of how much virus there is in the patients, how much is excreted by the patients. And because the method is really that you double the amount of the RNA, which we transform to DNA, you double it in cycles. Now, if someone else gets positive already at 15 cycles, that person's got 1 million times as much virus in their upper respiratory tract. And of course, those are the ones that transmit the virus, whereas the ones with less virus don't. And the problem here is really that you can be one of those with 1 million times as much virus as others, and you don't have either any symptoms, and you're not very sick at all.
You mentioned these PCR tests, and thanks for explaining. Now I finally understand these cycles. That the more you cycle, the better you get the results, or the more likely you are to get it. There's a lot of critique around the PCR tests that now they are done extensively all over the world, and we get more and more cases. So some people argue that we're living in October in a case-epidemic with millions and millions of cases, but that the ICU beds are not stretched at all in the same way as back in March, April. So what do you say to that? And what is happening with the virus now? Has it lost potency as well, or?
Unfortunately, I don't think so, but it's too early to tell. And I mean, if we're lucky, it has been, the potency has gone down. For instance, one of the less serious coronavirus is a strain called UHK1. And it appeared in humans back in 2004. And at the beginning, it caused very severe pneumonias. But today, it just causes a common cold. And it doesn't cause pneumonia any longer. And hopefully that will happen with also this virus, but we don't know. I mean, it could go the other way. And the other hand, what has changed between now and the spring is that we are much better in taking care of the patients. So I think that we won't be hit as badly as we were in the spring. But still, I think people will die, unfortunately, from the virus. And you can see that in other countries, that people are still dying. Although I must say that, I mean, people are testing more, and in that sense, you get a case demic, if you like, because we, for instance, in Denmark, they test 4 times as many per capita as we do in Sweden. And so, yes.
So, Olga, do we have any questions here from the audience? Or
I actually had a question regarding the elderly. It's in a potential second wave. Do you believe that Sweden is prepared to handle it better this time? If not, what would you suggest to be a safety measure? I mean, Sweden is known for not taking care of the elderly very good. That is like one of the main critics that most people have, and that also Anders Tegnell was admitting that was like one of the big failures. So what would you say about a second wave there?
I mean, it is very, very difficult to take care of any group. I mean, it's not us elderly. We have lots of other frail people, you know, risk groups. And I mean, it's a good. I mean, I can understand the idea that you should try to protect the frail and elderly, and we try as much as we can, of course. But it's extremely difficult. I mean, take the White House. I mean, you couldn't save the White House in Washington from the infection. About Sweden, will we handle it better? We could, if we started to behave after we've learned and have recommendations after what we've learned. I mean, if the Public Health Agency said, yes, let's use face masks whenever you're indoor and in crowded spaces and so forth. So social distancing is very, very important. And but so when you wear face masks, you shouldn't, you know, skip social distancing. You should do both.
But you say that they do work with one thing here. You can have anything here as a face mask here in California. You can take a T-shirt or bandana and just wrap it around. And I guess there's a big difference on what is working when we talk about face masks. It's not like anything.
But anything works. I mean, anything is better than nothing. And there are papers now that even if you take a cotton T-shirt, you know, just like that, I think that reduces by at least 50% the aerosol that you produce if you're infected.
Even though you are critical to the Swedish corona strategy, do you see any advantages compared to other European strategies? Like, are there any positive differences?
Not really, I must say. I mean, if you look at the countries that have done best, like Taiwan, 24 million people, and they had 7 deaths. New Zealand had 25 deaths. Sweden had 6,000. I mean, then it's difficult to say that the strategy is good, being good. Then you could compare, of course, if you like, with Great Britain and Spain and Italy. Britain, for instance, you know, that they were speculating about herd immunity, and for the first month they didn't do much. They did the same thing as Sweden, and of course the Public Health Agency in Sweden was very happy to have, you know, people that did the same thing. But then mathematicians and statisticians calculated that you know, it would be too many deaths if you went down that road. So they imposed lockdown, but it was too late. Same thing in France. In Italy, of course, they didn't have time. And in Sweden, I mean, since we didn't stop it at all, we started with testing and tracing. But you know, 2 weeks or a couple of weeks into the pandemic in Sweden, the epidemic in Sweden, they just gave up. It was too much. And I hope that we're slowly approaching the same strategy as other countries, but in my mind, we're doing it too slowly.
Some other questions that we have gotten a few of is something that Lars was discussing before. that is the school closings and schools opening in Sweden. Like Lars said, children in the US are not allowed to go to school. But in Sweden, we have the opposite, that the families are kind of forced to actually put their kids in school. So one question is, in Sweden, we have the opposite situation than in the US, with families with members in risk groups being forced to send their children to school. How do you assess the risk from children and families with members in risk groups?
The Swedish law says that you have to go to school. But when you have risk groups, and like I said before, I mean, children do get infected and they do produce a lot of virus, but children transmit virus mostly to those that are the same age, because they don't social distance and they play and they infect new others. And of course they can infect in the family. And I think that, you know, it's important for children to go to school. But if they go to school, why not let them wear face masks? In other countries, they do. And so if you have the measures, you could have the schools opened. But of course, if you're a risk group, I mean, it's to force someone in a risk group to send his or her child to the school with the you know, risk of getting infected. I think that's awful.
But it seems like face masks can actually help out in many situations. Like, people are also discussing the fact that having people not going to school or kids not going to school might be bad for their mental development, and also people might be have more mental issues and such things. But we have one question that is, considering that the mask issue seems to be about prestige, what could it take for the decision makers to change their stance and recommendations, do you think? At least in like hospitals, elderly homes, schools?
I wish someone could tell me, because, you know, when I was at the hospital, I brought that up and they said, well, we don't have any recommendations to wear masks, so we're not wearing masks. And in order to implement it, the authorities should say, you have to do it.
Another question about the risk groups. How do you believe they can handle the situation in the best way, like with the current or present situation? I mean, how can they practice like social distancing? What can they do to make the best of the situation with the recommendations there are? Yeah,
I mean, if you socialize, do it outdoors. And first of all, don't let people into your house and don't enter other people's houses. Don't go into shops, but I mean, do walk outside. You don't have to wear a mask, and if you really have to be indoors, wear a mask and ask them to open the windows.
That was some concrete guidelines to round up as we bump up on time here. We're coming up on 11 here in US and I guess 8 in Sweden. Some last words, questions, Saga, from your side, Lars, from your side?
Were you surprised that Trump didn't get hydrochloroquine when he was hospitalized?
No, when you're hospitalized, that's, I mean, if there is any effect of hydrochloroquine, then you should have taken it before, and it did, of course, as far as I understand. Maybe that was beneficial. I don't know. It's but when you're sick, it doesn't help to start treating with it. That's for sure. I was a bit surprised of that. I didn't use interferon, because interferon is very effective.
Thank you, Lars, for that last question. I think that opened up for a whole new webinar on treatments and maybe the difference in treatments with presidents and kings and the rest of us, but we have to take that another time. So thanks for everyone listening in. Thanks, Lars and Saga, and very much appreciate, Anders, that you came along with us here today, and hope you out there who are listening maybe to this later will enjoy it too. Have an excellent evening if you're in Europe, and excellent day if you're in US. Bye, and talk to you soon.
Thank you very much.
Bye.